Morning all. I think we've just got a few more joining at the moment, so we'll just leave it for a minute or two and then get going. Okay, I think we'll make a start if that's okay with everyone. First thing just to mention is that we are recording the call for people who aren't able to join us. So if anyone's got any concerns about that, please let us know. But we will be recording this and putting it up on Yammer later on. This is, I think, our third one of these calls, and I hope that you're finding them useful. We have got a few things on the agenda today. First of all, I was going to just give you an update on some of the things that have been happening over the last month, and then we'll have some time for questions after that. And then secondly, at about 10:30, Emma Chambers, who I'm hoping is here on the line, is going to come and talk to us about Office 365, and we'll have plenty of time for discussion around that as well. Can everyone hear me, first of all? Can someone just put a quick message on the message to say?
I can hear you anyway, Rosie. Yep.
Yes, you can all loud and clear.
Good. So what I would also encourage is do put any comments, have a chat on the conversation as we're going along. If you want to ask a question, don't feel you need to write it all down on the conversation. Just say, can I ask a question, and then we'll come to you and work through people's questions as we go, if that's okay. Okay, so the first thing I wanted to do is just, I know there has been some mixed messages about workload, and I know Ruth, I think, has either written out or is writing out to you all about the message around workload, but I just want to clarify this. So what we've been doing, we recognise that there's been quite a lot of different pressures across different regions, and what we want to do is allow regions to have much more flexibility to plan and manage the work. And we know that historically we've had this model of 6 inspections and 12 ARRs a quarter, but sometimes that's not straightforward because of enforcement and other things that come up. So we want to enable that flexibility. So we've been looking, firstly, we know there are some things we must do. So we must do the inspections that are inadequate, that require improvement, and new registrations, and we know that we must respond to changes in quality and make sure that we've done that appropriately. So we've been looking at this in detail, and the Directorate support team have been doing a lot of data analysis around this, and as a result of that, we know that we've got a number of inspections in each category and the region's contribution that needs to happen towards those, and this is being monitored monthly through the Head of Inspections monthly meeting. We are running a national programme, and we want to make sure that we have equity as much as possible across all of the regions. So I just wanted to clarify that. If there are any questions about that, let us know. But it's very much something that we're working through the heads of inspections, who will be discussing this with inspection managers and looking at that regional response. So that's the first thing to mention. The second thing, just moving on from that, is just a follow-up from the board meeting that we had at the CQC board meeting earlier in the week. And I just wanted to say thank you to you all for the strong performance that we continue to see across PMS. The board was informed in the public section that we're meeting the requirement for over 90% of inspections undertaken in line with our commitments, and 91% of inspection reports are published within the time frame required. They were also informed that the time lost to IT issues was reducing, and it would be good to get some feedback as if that is feeling how it is on the ground as well. So a very strong performance. So thank you all for your ongoing input into that, because we're only as good as the collection of all of the parts of PMS, and each and every one of you contributes to that overall performance. So well done, and thank you. We also discussed the CQC budget. At the moment, the revenue budget is projecting an overspend of £1.7 million. And the reason I mentioned that is if any of you have picked that up through the board meeting or papers, just to let you know, we are looking at actions across the CQC that can be taken to reduce the risk of that being a problem later on in the year. So we're taking early action. In PMS, we do have a projected overspend for a number of reasons, and again, we're having a look at that and taking action where needed. But I just wanted to kind of reassure you all we've got that in hand if that was something that you'd picked up. Moving on from that, I think the next thing I just wanted to mention was some of the in the board report we took. The PMS section mentioned a few things. One was that at the moment NHS England have got a consultation on digital first primary care. And for those of you who are involved in any of our online primary care work, it might be worth you having a look at the consultation. It's available online, and the consultation is open until the 23rd of August, and we're making a response to that based on the knowledge and expertise that the teams involved have built up with our work with online providers. But it does look at how some of the challenges that have arisen out of some of the online primary care providers working in the overall health and care system could be approached. So just to flag that, and it might be something you would be interested in. Secondly, we brought to the attention to the board two reports that the PMS teams have been involved in. So the Defence Medical Services Annual Report, which is available on the CQC website. So thank you to all of the team that have been involved in that. It's a really good report outlining what the findings of the second year of the Defence Medical Services programme have been. And secondly, there's also going to be published, and I'm not quite sure of the date, so if anyone in the medicines team is on the line and can confirm the date, but we're soon to publish the Control Drugs Annual Report, which is again a really good report looking at how all of the partner agencies across the system are looking at the safe prescription of controlled drugs, and I think a lot of progress has been made in that, but as with everything else, there's still quite a lot we do. Oh, Joshua, thank you very much. That's been published now. Brilliant. So that's out and published. So if anyone wants to have a look at that, I'd commend both those reports for a read. So thank you to all the teams involved with those. So just moving on, I just also wanted to talk about the change programme. So there's been a lot happening with the change programme, and we are working as a directorate very closely with Kirsty Shaw and the team. In particular now they're looking at trying to get the right the people with the right skills and experience into the change team to start to make the the changes and to look at how we progress the change programme. We think that with any of the change programmes, we are looking for subject matter experts, and we think that a small number of subject matter experts from PMS are going to be recruited into the change programme, and we're working to make sure that firstly we enable people to get the right opportunities into that work, but also that we don't have an impact on the day-to-day delivery of the programmes and on the teams on the ground. So that's something we're closely working with the change programme to do. I won't repeat all of that's been discussed at the Shaping the Future conversations, which are available on the intranet, but do have a look at those if you haven't. And I'm really keen that we get really involved in the discussions around this. So there's a Yammer group looking at the Shaping the Future conversation, so do put your thoughts down, go and join in the conversations, because it's really important that we get everyone's experience into those discussions. And moving on from that, just to also say that we're working closely with Debbie Westhead. Now, Debbie's been appointed as the Director of Improvement, Implementation and Evaluation. And as I think we've mentioned before, we're working with a group called the Oaklands Group, who have a huge amount of expertise around quality improvement. Quality improvement is something quite dear to my heart, certainly. I think there's a few things that are so important with quality improvement. One is making sure that we have the right environment and culture to really give people permission to get on and make changes where they see appropriate, that are going to improve how things are done. But secondly, I guess it's enabling people to have the tools that they can actually make sustainable change. We know across from a lot of kind of industries, people make change, but it isn't sustained, and often that's because the way of making change is not done in a structured way. And quality improvement often is about actually how do you measure things to make sure that what you're doing does improve the situation. How do you start to look at putting a structure into making improvements so that it does sustain, and how do you make sure that you look at the engagement required to make change happen. And the plan is to look at actually how do we start to get many more people across the organisation having the opportunity to develop these skills, learn new tools, and be able to really drive improvements across all of the teams in the organisation. Now, Anthony Hall has been chairing for some time the CIQ group, Continuous Improvement Group, and as you know, we've been doing some great projects with that group across the Directorate. And the first thing we want to say is we're very much carrying that on. That's not something that's going to stop. I think that's really been hugely valuable for the work that people are doing, and also it's great for people across all of the Directorate to be involved in these projects. So what we want to do is make sure, though, that the learning across the directorates is absolutely spread, and I believe that the plan is to have a quality improvement group that spans the organisation, where the chairs of the directorate improvement groups sit, so that information can be shared and we can learn from what other directorates are doing and work out if we want to follow suit and things like that. So I think it should be really a positive move forward, and I'm certainly looking forward to working with Debbie and the Oaklands group around this agenda. If this is something that I'd be keen for everyone to learn more about and get involved in, so we'll look at how we can make sure that people are very involved in that as we go forward. And I think the final update I wanted to mention before we go into questions and the Office 365 piece was around the Pulse survey. So it's really, really important that we hear everyone's views on how things are going, and what's working well and what's not working well. And the HR team have been working with the board and looking at how we can do that more regularly than the annual staff survey, so we really get a sense of what the feeling is on a much more regular basis. And so there's going to be a series of what's called pulse surveys launched over the next few months, and the first survey is going to be on the 22nd of July, which will be open for 3 weeks until the Friday the 9th of August, and essentially people will get an email inviting them to take part via an online link. I understand this will focus primarily on strategic change and communications within the organisation, but there will be some broader questions around experience of working at CQC. And what I would really encourage all of you is to fill in these surveys. I'm really keen to hear what you're all thinking. I'm hoping there'll be, I'll get that feedback from you in between, as well as some of you do contact me about feedback, and I'd be very grateful if you contact me any time about any feedback that you have. But I think this is a much more structured way that we can get some of that feedback and look at tackling any specific challenges. So please do fill in those surveys and put your thoughts down as much as possible. And if there's there is an email address to contact if there's any questions or issues about the survey, which is staffsurvey@cqc.org.uk. And I think the plan is to carry out the first of the I think 3 surveys are planned to be carried out by the end of the year, as I understand it. So I'm going to stop there for a minute and just say, give some time for some questions, and any thoughts or comments or anything. It doesn't have to be about what I've talked about, it could be about anything at all. So any questions or comments or thoughts? Don't be shy. There's no silly questions. I often have lots of silly questions, so please do ask. And I think no. Okay. Well, if we've got a couple of minutes, Joshua, this is putting you slightly on the spot. Are you still there?
Yeah, I'm here.
Yeah. Would you be able to just give us a couple of headlines from the CD report?
I can do. I've only read it very briefly myself. Basically, it goes into what we found from the end of, so it would have been, it's more dated back on the data from 2018, looking at the information that's been shared at the CD LINs that our team attends. So that's like a local network of NHS trusts and the police, etc., and they sort of share information basically around controlled drugs, and this sort of was all fed into it as to how we're working on a national level of sort of looking at what's going on with controlled drugs. The main bits that it talks about in this report is the increase in opioid prescribing across the UK, looking into how the Gosport independent panel reports affected controlled drugs monitoring, and also looking into the changes to pregabalin and gabapentin, because they've become a controlled drug now, which they weren't before, and that's increased the demand on sort of supply on the providers to basically how they hold on to that, and also looking into the cannabis-based medicinal products, which is sort of a big point that's up and coming, and I know we're in the process of doing some registration around those cannabis clinics, but it's all a bit up in the air at the moment. So yeah, bits and bobs around that basically as a quick starter for 10.
Brilliant. Thank you very much. I'm sorry to put you on the spot.
No, that's all right. That's okay.
And just to let you know, because I think the medicinal cannabis clinics, they're a fascinating area, and I've got a call coming up with different people across policy and our team to have a discussion about that, because, like you say, there are a couple of clinics starting to register, and I think there's a potential for it to be very high profile. And
I know our head actively sitting in on the initial registration, so there she's actually supporting that, because it's not something we've obviously ever covered before. So hopefully she will pick up on what's going on and sort of be able to support the registration team on that. But it's difficult because I don't think there's any at the moment, as far as I'm aware, there's not a licensed cannabis product that's based in the UK, so it's actually the supply of it from a legal point of view that's really difficult at the moment.
Yes, it's an interesting area, and certainly something I think we need to kind of get hold of quite quickly, really. So so thank you. And I just wondered, well, before we go into the Office 365, have we got anyone from the DMS team who wants to give us some high-level thoughts from the DMS report? No, not here today. So so maybe we can cover that in the next meeting and just give some high level thoughts. And if going forward in these meetings, if there are things that you'd like to just share from the work that your teams are doing, please do contact myself or Ange, and we'll get them on the agenda, because I think this is a very important. It's not just me talking. I think it's important that we share everything that's going on across the directorate. Okay, so in that case, if I haven't seen any questions come through as yet. So in that case, Emma, are you on the phone?
Hi, Rosie. Yeah, I'm here on the phone.
Fantastic, thank you. So I'm just going to introduce Emma. Now, Office 365 is something I think is really exciting for the organisation. Emma's here to tell us more about it. I certainly we had another presentation at the board this week from the team, and I think the potential for this is huge, and it could really transform the way we do things. So so over to you, Emma, to take us through it, and then we'll have a discussion afterwards.
Thanks, Rosie. So hi, everyone. My name's Emma. I'm part of the Office 365 project team, and I'm supporting the business engagement and communication side of things. So I'm working quite closely with Andrew Ford and Vicky Wells in terms of supporting PMS with the engagement and the training. So on this call, I'm aware I don't have too long, so I was just going to run through the plan for PMS for Office 365. So just as a background, really, we had our alpha. So alpha is just a first test, and this was 50 users. And the 50 users were onboarded onto Office 365 on the 10th of June. And these guys were using Office 365, using Teams, OneDrive and SharePoint. One of the key pieces of feedback that we got was that we shouldn't do a blanket approach to engagement. So, for example, we gave everyone in the alpha the same email, the same comms, the same training styles, and the same support. But we realised that directorates work very differently. So heading into the beta and the rollout, we're doing a direct...
Emma, sorry, just to interrupt you for a moment. I'm not sure everyone across the organisation will understand the terms alpha and beta. I certainly didn't when I joined the organisation. Yeah. So would you mind just explaining before we go into that what that actually means?
Sure. So the alpha is just a first test phase. So this was just 50 users. And these 50 users were very, very close to our project. So we work with them daily. So they all got Office 365 and were trained and started using it. The beta is simply a second kind of test phase. So that's 300 people from CQC who are in the beta. So we have dentistry and the delivery team from PMS on that beta. And then it just goes into a main rollout, which starts on the 5th of August. So in terms of our planning, we're taking a directorate by directorate approach. So I'm working closely with Andrew Ford and Vicky Wells to build a engagement plan for PMS, which is based on your engagement preferences, your training preferences, and your support preferences. So what I was going to do in this call is just run through kind of at high level what the plan is for PMS, and then we can answer any questions you may have. So in terms of engagement calls then, we have, they start next week, and there's one on the 24th and 26th. You should have received invites for these already, but this call here is just what is Office 365. So I'll do a demo, I'll show you the benefits, we'll talk about what actually Office 365 is. So this will really help those who maybe have not heard of it before. So there's 2 calls running next week, and you only need to join one. It will also be recorded, so if you're unable to make both of those calls, we'll make sure that you can still view the recording. Week commencing the 29th, we have 2 more calls, so they're the 31st and 1st, and this call will be how do I prepare? Again, you only need to join one, but here I'll go through the support available to you, more details about the training, and if you've got any questions, where to go with those questions. Then for everyone, so just say if you're in the dentistry team, you'll be getting Office 365 on Monday, but for everyone else in PMS, you'll be able to book onto training from the 5th of August. So you'll have a range of Skype sessions, and they run basically every day. So we hope to share the link for those on Monday, so you can start putting those into your calendar and booking on to your training session. So in terms of the training then, it's 1.5 hours and it's on Skype. And here we'll be training you on all your 3 tools, so SharePoint, OneDrive and Teams. Within this checklist, we also hope to, within this training, we also hope to give a checklist. So this checklist, you'll be able to take away from the training session, and it'll have a few things that we would like you to do with your new tools. So for example, it might say, can you make a call using Teams? Or can you privately message someone on Teams? Just very simple tasks. And if you go away from that training session and unable to fill that checklist, you can come to us and we'll support you with any questions you may have on that checklist. Or if there's any other things that you want to know about Office 365, we're always to help. So after that training session, which is 1.5 hours, you also have the ability to join various support mechanisms. So, for example, we have virtual drop-in sessions running every day, twice a day for all of CQC. So these drop-in sessions, there might be one that's very broad, so you can go in, ask any question. But we might have also a virtual drop-in session that might be Microsoft Teams based, or Microsoft OneDrive based, or SharePoint based. So you can pick particular sessions dependent on what that virtual drop-in session is about. So these virtual drop-in sessions will run throughout the alpha, and the alpha said that these, really helped us learn more about Office 365. We were able to ask all our questions and kind of learn really cool things to do with Office 365 as well. One piece of advice I would give is, even if you don't have a question or you don't really have any idea of what you want to ask, still join those calls, because the enablement experts that we have who know Office 365 ins and outs will still give you some hints and tips. It might just be useful to sit in on the background and just pick those up as well. So alongside those virtual support sessions, we also have tech bars. So think Apple Genius Bar. We've got those in almost every CQC office. So I know a lot of you are home-based, but just say you're in the office for a particular meeting or an event, we'll have a tech bar there, and you can come up to that tech bar, you can ask any questions, you can get one-to-one support. If you want to clarify something from the training session, we're more than happy to help you on that tech bar format as well. So no question is a silly question. Please do utilize these support channels. They are really going to help you learn Office 365. So also with the training session, you only need to join one Skype session. However, if you've joined one Skype session, you think, you know what, I think I really want to recap what we've learned, or I didn't quite understand that section of the training, you can join another one if you like, but they will be identical. So you do have that option if you do want to, remind yourself of what the training session was about. I can emphasize that sometimes it's quite overwhelming as well. So there is that option for you. Okay, so what I'm going to do now is I'm just going to post our Yammer group. So we have an Office 365 Yammer group, and this Yammer group started from our first test phase users, just as a community to help each other, to answer questions. We share hints and tips, we share videos, there's a whole host of information, and I really enjoy using it. We've had a really good positive feedback from it. So I'm just going to post the link now. So the group is open. You can join that group. You can look at, what's going on with the project. If you've got any early questions, anything like that, that Emma Group is there to support you. I can also see Fanula, thank you, has shared the link to the intranet. So on the intranet, we have a whole host of information if you want to read more as well. So the engagement calls, which start next week and run for 2 weeks, are really, really important. If you want to get the most out of Office 365 and kind of go into a training session, really understanding what you need to do, I recommend joining those engagement calls, because I will be talking through exactly what you need to do to prepare, show you exactly what Office 365 is, and we can have a Q&A session at the end as well. So they're put in place to support you. So I look forward to seeing you on there. I'm aware that the Skype conversation's gone quite crazy. I'm aware that I need to answer some questions. So does anyone have any questions before I start on the Skype chat?
Emma, I've covered. It's Vicky here.
Hi.
I've sort of been covering the questions and as we've gone through, Emma.
Okay.
Thank
you.
And I think it'd be helpful to know if people have experienced using 365 in other walks of life. I know that there are several that have come forward.
Okay, great.
So I think that's helpful. And the intranet, I know over the last few days has been loaded up with a lot more information. And I've said in the message that for people that are interested, it's helpful to have a look on the intranet, but it's not essential. I'm mindful that sometimes too much sort of pre-reading may cause unnecessary anxiety, and for some people it may just work better to join the calls next week.
So the calls I will explain exactly what you need to know. If anyone's keen bean and wants to read up, feel free to look at that. But there's just one question on the Skype chat that I want to answer. So there was a question: could there be any written materials in advance so that those who are happy / prefer self-training can have a look to see if we need to join the training or can give it a go ourselves? So absolutely, yeah. So we do have self-service guides that if you just want to kind of print those off and get on with it, and those self-training guides will teach you how to use Office 365. We're aware that there are some very technical people in CQC, and they would rather just, instead of joining an hour and a half Skype session, and they would just like to kind of get on with those guides. That's absolutely fine. However, if you do want to do those guides, please let me know. I'll put my email down, but just please let me know if you're happy to do the guides, because I need to have a look at, I want to keep a track of who's been trained and who hasn't as well. So I'm more than happy for people to do that. I'm just going to actually share my screen and show you where they are on the intranet if you want to have a look before you book onto a training session.
And David, you've asked if the calls will be recorded. So they will be recorded, and there is an opportunity if you do join a training session and that you think that you need a bit of a refresh. Looking with the number of training sessions that are on in August, it looks like there will be sufficient capacity for people to join another session if you want a repeat. I think they're every day during August, aren't they, Emma?
Yeah.
So we have got enough sessions built in there for if people did want to repeat the hour and a half.
Has anyone else got any more questions?
I was just interested to hear, because Susan Taylor mentioned you're one of the testers, Susan, and I just wondered if you would be happy to share any experience, any thoughts that you've had being one of the testers.
Hello, yes. I'm in the very, very early stages of it. I found it very intuitive, and when certainly much, much more stable than Skype seems to be when having conversations. The one thing, and this, I think this is because I'm inexperienced as a user, that is a little bit more difficult is where you have the taskbar at the bottom and the screens for everything that you've got open is a little bit harder to work with, and I'm just trying to find my way around that. But I don't want to put people off because I think it's more about me testing it and learning it. So, but I can see good things. A feature that I think is going to be so helpful is being able to share the same work on the same document at the same time, and I can particularly see that would be helpful if you're working as a larger team doing a provider at scale inspection, and you could be drafting the same report at the same time rather than having back and forth in emails. Equally, if you're doing enforcement and the inspector and manager or other inspectors needing to write enforcement letters, again, that would be very useful. So, but early days, but positive.
Great, thank you very much. Any further questions for Emma? Or any questions about anything else? Thank you ever so much, Emma. I'm really keen that we want to make sure that this goes really well, and from what I understand, Office 365 is one of those things, the functionality, the more we use it and are kind of prepared to try out different things, the better functionality we'll get out of it. And I'm certainly no IT wizard at all. I'm quite definitely in the inexperienced end of the camp, but I'm from what I've seen, I think it looks, like Sue said, very intuitive, and it should really help the way we work. So thank you, Emma. And do, as with everything else, do feedback any experiences. If you're not feeling, getting enough engagement or support around this, let us know. But the team have worked very hard to make sure that people get all the opportunities to get support and training. But we want to make sure that that's right. So keep in touch around it. So we've got some time now. So is there any anything else people want to cover in this call? Any questions or comments at all? Any areas that people would like to see on the next call? Do send them through. So I was just thinking it might be useful next time to dedicate some time talking about some of the primary care network work that we've been doing, because I think that's going to be an area that will affect all regions. And so we'll bring that back, if that's okay, to the next call. Amanda, you've just put about the Level 6 regulation course. Are you able to feedback a little bit about that?
Yeah, absolutely. So I've just completed a 4-day course, and it's a BTEC Level 6 Professional Certificate in Regulatory Skills in Health and Social Care. In PMS we were offered 2 places, and myself and Lindsay McGeary attended. A really good course that's going to be rolled out to, I believe, all inspectors in the near future. So look out for it. It's been really good. Lindsay's on, I can see Lindsay's on the call as well. Really enjoyed it, didn't we, Lindsay?
It was absolutely brilliant.
I'm just saying thank the Lord after all the work I put in with everyone.
Yeah, really good, really informative. We had 2 days training with a barrister, talking a little bit about the law, what's an act, what's a regulation. Really informative. The stuff that you think you know, but actually to sit there and hear it from the expert was really reassuring. And then days 3 and 4 were with an ex-detective who covered a lot of information around interviewing, gathering evidence, evidence bundles, what to expect if you're at a tribunal, or a court case. And then we've got 2 assignments to complete now over the next couple of months, which are going to be linked to writing witness statements, gathering evidence. So yeah, it's been really, really good, really informative.
Good. And I've got a follow-up. I've got a sort of follow-up call today to see how everybody felt it went from the sort of people who were giving the training as well. So it'll be interesting to see how they felt it all went.
Yeah, so hopefully be rolled out shortly. So keep your eye open for it, and worth getting on.
Thank you. That sounds brilliant, and thank you for that feedback. We'll look forward to it being rolled out. Fantastic. So moving on to the next question about pay increases. So on the news this morning was the government statement about pay increases for public sector work. So my honest answer to that is I'm not entirely sure what our position is at the moment, and I'm wondering if there's anyone on the call who has got that knowledge. Otherwise, I will get the answer to that and circulate it to everyone. And I think certainly yes, I think what I'll do is I'll get the kind of official position from Rebecca France and circulate it to everyone, but so I can be clear about what the position is. So we'll do that today. Okay.
Rosie, it's Vicky. Can I just a reminder, and I know that we that this reminder has gone out, but I don't think we can remind people enough just around booking trains and cancelling them, that it's no longer that if you don't collect your ticket, we don't get paid for it. We have to actually cancel train tickets through the system. And I know I had a conversation with Claire Gannon from Finance yesterday about it, and she's really keen that we keep emphasising that, because it's quite a significant cost if we don't claim it back.
Yes. That's really helpful. Thank you, Vicky. And I think, we need to be thinking with everything that we do. We're spending public money here. We need to just make sure that we get the best value out of every pound that we possibly can. So when we're booking, we certainly don't want to stop people having meetings or anything like that. That needs to all continue. But when we are booking transport or accommodation or meeting rooms, just be very, as I know you all are, just be very conscious about the most cost-effective option that's available. And I'm a great believer in the kind of saying every little helps, and I think we all need to think about that. And I think also with the external meeting rooms, it's also thinking about the cost of refreshments as well, because sometimes the meeting room itself is cheap, but the external the refreshments are expensive, so it's kind of
blimey, I can't remember the last time we had refreshments, Rosie. Bring your own. Can I just warn people to be very, very careful though, because the cheapest option is not always the best. So if you're getting an advance ticket, you won't get a refund.
Yeah.
As I found to my cost when I tried to do it the other day. So at the advanced, although it's often cheaper, if you think there's any doubt whatsoever that the meeting might be cancelled or you may not be going, I would advise people not to take that option, because it won't necessarily be the cheapest in the long run.
Absolutely. So it's cost effectiveness, I think, rather than cheapness, because we want to make sure that we just are conscious of that. So thank you, Bev and Vicky.
Rosie, just still on the budgets, I'm mindful of the conversation with Finance. And Claire is going to have a conversation with Directorate Support colleagues, because our bookings for the free government space, so meeting rooms that we can use for free, is exceptionally low. Now, my feedback to Claire was we do often try, but we're unable to get them. So Claire is going to do a little bit more work around that. But I believe there were only seven rooms booked last year.
Vicky, sorry, can I just come in on that? Because we booked direct with the Environment Agency, and we're in there probably 2 times a month, so I'm not sure how they're collecting their stats.
Yeah, so that Paul, could you just message Claire Gannon about that? Because
Yeah,
I
of
thought
course.
the numbers seemed very low.
Yeah. No problem.
But again, when the list comes out, it's a long list of free space that we can use, but I'm just not quite sure.
Vicky, it's very difficult to book. So we've used one previously in Guildford, but the contact there seems to have changed, and we've tried several times again to book it, and they keep telling us they don't know anything about the arrangement.
Yeah, so again, I think if you could feed that back to Claire Gannon, because Claire's going to take it up with our directorate support team, because there must be something that there's something that isn't quite working with the book, with attempting to book and being successful booking, and it could make a big difference to our budget this year if we can get this right.
Yeah, I think a lot of us are doing different things on, because I know that a couple of my teams have a meeting which is central for them. But it costs a little bit, but it's cheaper than if they all got in a car and travelled to the Preston office or Manchester office or something. So I think as long as we've got an explanation for why we're using something and where we can, trying to use the free ones, I think, we're okay.
I also think we need to look at our internal rooms. I was talking to Heather in the Birmingham business team, and how often we're told there's no rooms available, have to go external for a room to find that the Birmingham rooms were never used. So they're getting booked up, but then people aren't cancelling them. So I really do think we need to look at how that's managed.
Okay, so I think it sounds like there's quite a few issues that we need to work through here in terms of rooms and both external and internal. So if you could all, I'm just wondering if it's going to be better for us to collate all this feedback with the directorate support team. So if we can take an action for Andy, who I don't think is on the call today, to look at the team and seeing if we can collect all this information and then work with the finance team to resolve them. So I think because I think there's some really helpful comments that you're making in the conversation part here. So I think we need to look at this in a bit more detail. So thank you for that. Okay, anything else anyone wants to share or discuss today? No? Okay. So whilst discussions are on, we can talk, yes, so thank you, Emma. What we'll do is we'll take that as an action and we'll talk about the business plan and the budget in more detail and what that means in the next call, so we can certainly do that. And there's a question here about stationery issues from Bev. So
I just wasn't sure who we could actually make comments to, because I, for one, think we're spending a lot on those little fiddly black ink cartridges, and the recycled paper is just absolutely appalling.
Yeah.
Okay. There are so many conversations around the ink cartridges on Yammer.
Yeah, I've got a drawer full of old colours, every colour imaginable.
Kirsty's well cited on it, but I have to say we're not really seeing we're not seeing any change with it. So I'm not quite sure what else we can do, Bev, with that.
Okay, well, I think if we can, and again, if I talk to Andy, and we'll ask for the directorate support team to put together a list of the issues, and then I can kind of, if we're not getting there, I can escalate that with Kirsty and the team, and see if we can look at sorting that out, because it seems to be an ongoing issue, doesn't it, which doesn't seem to get resolved. So we need to sort this out. Okay, and then there's lots of good examples about ordering black cartridges and swap shops in the southwest. So I think that's great, and we need to kind of share those good examples. So and being promised large black cartridges would come a year ago, but they clearly haven't. So let's take this off, and and see if we can try and resolve this again. Okay, so it's interesting. These have obviously hit a nerve with people, which is good because we want these discussions. I
think what's interesting, Rosie, is that sometimes it's the very basic things, or often it's the very basic things that cause the most challenges for people.
Yeah.
We've gone through the process of identifying what some of these smaller challenges are that would make a big difference if they were fixed. So this will be familiar. I'm sure Andy will be keen to pick it up again. But I think this call just demonstrates how we need to get the real basics right for people.
Yeah. Okay, that's really helpful, Vicky, and it's really helpful to see your comments, and I will take that away and work with Andy, and we'll do everything in our power to try and resolve it for everyone, because I can recognise the frustration from some of the comments here about this. So, okay, thank you for that. So what I've seen so far is that there's certainly a couple of areas we'd like to see on the next call. So we'll pick up something around the budget and business plan, and we'll also pick up something about primary care networks. If there are other areas that people would like us to cover in between, do let me know, or if you want a few minutes to talk about something, then do let me know, and we can put that in the agenda. Ange is going to do a little poll at the end to see how useful people are finding this. And as always, this is only kind of one part of an ongoing conversation, and do contact me or any of the team at any point just to ask any questions or feedback or raise any concerns, because we do want to hear them all, so we can continue to look at how we improve things. So unless there's any more questions, and I'll just leave. Any more questions from anyone or anything else? No? Okay. So unless there's anything else, we'll call a close to the call now. Sorry, let's articulate that a bit better. We'll end the call. And I hope you all have a lovely, lovely weekend. And for those of you who are going off on holiday at all over the summer, do enjoy yourself and get some proper rest. So goodbye everyone, and thank you.
Thank you.
Thank you.
Thank you. Thanks.